Well, hello everyone. Welcome to the workshop.
Hi.
We'll just wait a couple more minutes until everybody gets time to arrive.
Can you hear well? Okay.
Great. So let me know, like in the chat, who are you a little bit, if you are a student, if you are an instructor, advisor, or a professor, just to get a little bit more an understanding of who is in the other side.
Mm-hmm.
Great. Welcome. Okay, so I think maybe we can get started. As more people come, they are of course welcome to join. So first of all, thank you very much for being here with us. It's a great pleasure to meet you all. I am Raquel Vilaga. As you can hear from my accent, not native American. I am based in Portugal. I'm here with my colleague Ana Santa.
Hi,
She's also
everyone.
based in Portugal. And today we're going to talk to you a little bit more about Body Interact. Probably the majority of you don't know Body Interact yet, but I hope that at the end of the session, you know a little bit more about it. And of course, if you have any questions, I suggest that you put down in the chat box, and maybe in the middle of the workshop we can see if there are questions. If not, we'll save them to the end. So I've just prepared a presentation for you, which I will start sharing now. Can you see my screen? Yes, perfect.
Yes,
Okay.
Raquel.
So
Yes.
Body Interact. Body Interact is a very innovative and cutting edge technology that allows for students to practice with virtual patients in order to save real life. So this is what we aim for and all that we do. Just a little bit about us. So we are, as I told you, a Portuguese-based company. We are called Take the Wind. We have offices in Coimbra, Portugal. If any of you comes here, say hello to us. But we also have an office in Body Interact office in Delaware in the US. Our product, Body Interact, the virtual patient simulator, is currently used by over 200 universities and schools across the world. We have reached last year 130,000 users. So due to the pandemic, everything went online, everything needed to be virtual. So we had a very good increase of users, currently based in 170 countries. These are some of our US reference clients. So we cover most of all the healthcare spectrum. So we can start with a very basic cases and introduction to the health sciences. And we work with high school level institutions and career and technical schools as well. But then we can move also to nursing schools. We have programs for nursing, for medical, and also for postgraduate careers. Recently, we have received a very important accreditation or certification from CAPC. So CAPC is an American body that is charged with reviewing and accrediting EMS continuing education. And Bot Interact has met all the criteria and we can now be accredited for all the activities that we do also for the EMS, more specifically EMT and paramedics. So why do we exist? What we are here for? What problem are we trying to reduce? So according to the National Center of Health Statistics, medical error is the third leading cause of death in the US. So our vision is to be an adaptive platform that helps to accelerate the clinical education and assessment through the virtual patients. So we believe that the sooner the students get exposed to a lifelike scenario that they can make all their decisions and see patients and see clinical cases, the sooner they do this, the better they will be prepared and more confident to see real patients and face real challenges in their daily lives. So some of our guiding principles, so we design safe educational environments that are very, very similar to the real world. I will show you just in a few minutes what is it I am talking about here. And Bot Interacts also helps a lot to bridge the learning gap between the theory and the real world knowledge that you have to have as a health professional. So we help students and professionals to be integrative, critical thinkings. So it's all about analyzing the problem, making your decisions, training your clinical judgment, and of course, improving the patient safety across the healthcare experience. And we also believe that emotion plays a very critical role in the learning process. And Bot Interact is like case-based approach. So it's kind of like a serious gaming environment, very interactive, very emotional, very stressful as well. So it's very like a flight simulator, but for doctors, nurses, and other healthcare professionals. So from an educational point of view, so if you're educator or advisor or tutor, how can Bot Interact also help you to teach and pass all your knowledge to your students? So first of all, we help to bridge the learning gaps from theory to practice, as I told you, in an interactive case-based approach. It also allows you for each case to do a very thorough assessment, to have a very interesting clinical discussion, and based on the generated performance reports that Bot Interact provides you at the end of a case. It's also possible to monitor and analyze each of your students' performance, and it facilitates the development of course, clinical reasoning, judgment, and decision making. So Bot Interact also allows for every student to go over the same case, the same patient, individually or as in groups. So it helps the standardization of the learning process. So imagine if you have like a group of 100 students. Of course, when you go to a hospital, it's very difficult to get the same 100 students to go through the exact same patients. But here you can do unlimited times. The repetition process is also very helpful. So you can do over and over again in order to reduce your errors, to understand what you've done correctly, what you need to improve in your practice. And of course, all of this without harming patients, without putting anyone in danger. Just a little wrap up of Bot Interact, how is it used for education? So it helps to reduce the clinical errors. It provides real-time feedback, either on the simulation or at the end. So it allows also for a very interesting discussion of cases. Standardization of clinical encounters. As I told you, we have a very, very wide library of virtual patients that mimics real patients and cover the most, from the most casual to the most rare situations in a clinical setting. It also helps to overcome simulation space limitations. So probably most of you have a lot of simulation and more specifically mannequins in your centers. But Bot Interact is a cross platform technology that can be used, for example, such in an interactive virtual table or by iPads or iPhones, etc. So it's can be used basically anywhere, anytime you want. And the students are the one taking the lead. So the professor, instead of just like telling what should be the patient outcomes, imagine if you're doing a clinical case, instead of just being textbooks or PowerPoints, the students can really take the lead here, be able to conduct their clinical approach on the patients and learn from their own mistakes as the tutor or the professor can help and provide even thorough feedback as they do the cases. A little bit about the simulator. So the simulator has a physiological algorithm behind that makes all the cases and all the patients react like virtual patients. So all the cases start with an initial briefing, and then you can follow your own path in the simulation without anyone telling what to do. And you have several options since you can monitor, since the visual symptoms are very important. So the patients can be sweating or crying or in pain. They also talk to you. You can have you can here take the clinical history and the patients react to everything that you ask to them. You can also perform and learn about the physical examination. So we have more than 80 items in physical examination that you can do to the patient and learn from it. You can also monitor in real time how the patient is improving or worsening his condition. And you can also have a very wide range of examinations, medications, and interventions that you can do to reach out to a diagnose and treat your patients. So we have a very interesting family of virtual patients. They can go from babies to seniors. They're also from different ethnicities. So of course, it's very important to be prepared to any kind of patient that can appear to us. They have the most different diseases and problems. So it's very interesting, and we'll see just in a few minutes. We also have difficulty levels according to the target. So we can start, for example, in a high school level with very basic and initial cases. So an approach, very basic approach to a patient, but then you can move to intermediate and advanced scenarios where you really need to think critically to solve several critical conditions of the patient at the same time and have very advanced diagnosis and treatment approaches. We cover specialties as you can see here. So we started in cardiology first, then we moved to neurology, but then last year we reached more than 19 medical specialties. So we are always growing in the number of cases and specialties that we cover. And just a little bit more about our clinical scenarios. So most of our scenarios are emergency room, but you also have outpatient visits. So you follow a patient through several consults, and also the pre-hospital level. So imagine you're a first responder, EMT, or a paramedic. We also have scenarios that happen at home, or a patient collapse on the street and you have to help him, or in the process of being in the ambulance and bringing the patient to the hospital. So our physiological engine is very, very advanced. It covers over 500 health conditions. There are also a lot of physical examination items, medical tests, imaging lab tests, etc. A lot of interventions and medications as well. For the educator point of view, we also have a built-in learning management system that allows you for one hand to know, to have more information about each scenario so you can understand, depending on your teaching objectives and your curriculum, to understand which cases are appropriate to whichever class you're conducting. But you can also have the possibility to assign specific cases to the student. So imagine if you want to do a flipped classroom environment, and this is something our clients do a lot. So imagine for the weekend, you can assign cases to your students and they prepare it. And then next week, you'll be discussing the cases. You can review the cases again in the classroom, but they already have their own experience. And of course, you receive detailed metrics about each individual performance of the students and how they did and where did they struggle. Last year, we have conducted a very interesting impact study across 8 countries in 11 schools in medicine and nursing curriculums, and we achieved very, very interesting outcomes. So just very quickly, just to tell you that 94% of people thought that it was very highly satisfied about the use of Body Interact as a new teaching tool. It's something very different from a simulation experience with mannequins or just test trainers. It really is very immersive. You really see the students very engaged in the process of learning. 92% also stated that Bar Interact helped to bridge these learning gaps that I've been telling you about. So it's very, very difficult to train actually that critical thinking and the decision making because all that you learn in a theoretical encounter, you cannot apply it as you are a student in a real patient. So it's always an experience that you are not the one in charge. But here, Body Interact helps you to make and practice the decision-making strategies according to 94% of people, and also felt that it helps to provide a really good feedback on the individual learning. So these are the main conclusions that our teachers have concluded. So as I told you, optimizes the discussion of clinical cases, helps in the development of communication and teamwork skills, which is something very, very important. So you can have a group of students going through the same case, making decisions as team and deciding with each other which treatment approach and diagnosis should they follow. And as I told you, it's available anytime, anywhere, so you don't have to be restricted to a certain classroom or a certain simulation center. You can bring the virtual patients to wherever you are. It's available on this. We started having this interactive table, so in the very, very beginning, we only have Body Interact available in these tables, but then we moved to other devices such as computers, laptops, and mobile phones. So the learning can be done anywhere, anytime you are. And now I would just ask if anyone has any questions before I move ahead to the actual simulator so we can see how it actually works. If you have any questions, you can put it on the chat box. And I'm going to share with you again. Okay, we have a question. Can this be used in the nurse aid program? So yes, Body Interact also have cases in nursing. So we have very basic level cases that can totally fit a nursing aid program as well. I can send you more information. It's also available on our website, but in the end, I will leave you with my contacts. And if you want to request a trial or something, it's also possible. So for the simulator itself, I have already opened here. So today we have a patient, Mr. Victor Janssen. So it's a 50-year-old man who was collapsed in his office. He has regained conscious now. He's able to walk and assisted as well. But we have to figure out what has happened to him, what is he's suffering from. I think I did not share my sound, so I'll just share again. Okay, here it goes. So our patient, as you can see, is sweating. He's also moving his arms. So we have to understand and figure out what happened to him. So I would start by asking a few questions to the patient. So you can ask questions on medical conditions, for example. So how are you feeling right now?
It's Monday.
Okay, so maybe that's not the question we were expecting. We can continue with further questions.
I want to go home.
Okay, so for example, are you feeling any pain right now?
I took a bath yesterday.
Okay, so this seems a little bit confused. It's something that happens a lot to the patients as well. Maybe we can keep on with some
Yes,
questions.
my doctor told me that.
Okay, so you can also have some questions on medication, for example, to see what medication he's taking right now.
I'm taking this Gleeman, Damiron once every day, and I'm also taking aspirin, also once every day.
So as you can see, there are many questions that you can do. They change, of course, from case to case. Not all of them are considered a priority, so it's up to you as a student to decide which
I'm feeling really tired.
are critical or not to do to this patient. For the physical exam, you can follow an ABCD approach. So imagine if you want to start by checking the airways of the patient just to see if they're clear or not. So this one seems clear to me. We can just remove it. You can also do, for example, a lung auscultation, a pulmonary auscultation. So you can just grab it and also and continue on, for example, checking the pulses, doing pulse palpation, heart auscultation, etc., etc. So, of course, you don't have your hands-on feedback. You don't actually feel it, but you have a feedback that tells you how is it happening. And also, for example, on the disability, you can check the pupils of the patient. So I would just move to see a little closer the head of the patient, and you can drag it to see if the pupils are reactive or not. So on the monitoring, I will turn on the vital signs, but then I will turn off so it's not too bother for you because we're gonna really hear the beeps just like in a real emergency room. So as you can see, you can have real-time monitoring of the patient's vital signs. So everything updates in real time.
I'm feeling really
If I
tired.
do wrong decisions to the patient, I will see immediately an impact on the patient. If I do the correct decision, the case will end successfully, and I'm ready to have my feedback on my performance. I can also request some tests. So for example, a 12-lead ECG.
Just a moment, here is the ECG.
Or for example, if you want to have some imaging tests as well, of course, I'm not conducting a real case here as we should do in the emergency room. Don't judge me. It's more to show all the possibilities that the simulator has for you, for your teaching.
X-ray, we only need to bring the machine here.
And I would order as well, for example, one lab test of biochemistry.
A full biochemistry has been requested to the
You
lab.
have your patient, you can conduct physical exams, you can start thinking about a diagnosis with all the tests that you can do. And then you can also jump to the treatment part where you can, for one side, call a specialty. If you are an early year student, you don't know much about the treatment options. So you can send a patient and call someone that knows. So you have stabilize him a little bit. And then he's ready to move to another department. And you can also have and perform interventions. So my biochemistry here, I will just remove them from the screen. At any time, I can review them and check again here. So I will be coming here soon. In terms of interventions, you can also do
I'm feeling really tired.
very basic instructions, since just inserting a catheter in the patient, for example.
Inserting
Or
catheter.
you can also do, for example, provide oxygen. And here you have to choose how to deliver it and how much as well. So imagine if you want a high flow mask with 4 liters. Okay, the
1
is
minute.
correct or not. I will see.
High flow mask in
I
place.
keep doing my decisions as I'm the simulation, and at the end I will receive very detailed feedback of what I did. In terms of medications, you can also choose first a category. So the most basic level cases, they don't have, you only have to choose the category of the medication. Okay, so for example, if you want to give fluids to the patient, you just pick fluids and you don't have to make pharmacological decisions. For the most advanced cases, you do have to choose the medication and also how to insert it and how much. Okay, so imagine if I would give 6 milliliters to this patient. At any time, as I told you, you can come here to the medical records and review again. So it allows you also to compare exams. So imagine if you want, if you order an X-ray at the very beginning, it is a patient with a respiratory or pneumonia, but you can also do some medication that helps to improve, and then you can redo the X-ray and the comparison, of course, will understand if your actions were correct or not. So this is very briefly what's everything you can do in the simulation. Of course, you can also make wrong decisions and you see them, if the patient is getting worse, if you're getting unstable or not. And if you do everything correctly, you would have a success message. So this was a hypoglycemic case. This was not very complex. I administered glucose to the patient. I have assessed him and it says that I achieved the success. So now I go to the debriefing part where I would choose the most likely diagnosis. At the end of each case, you always have this option to choose the most likely diagnosis or condition that the patient has. Then you get a feedback of if it's correct or not. Here, this is just a moment for thoughts and feelings. So you can say if you enjoyed or not the scenario, if you feel confidence about your performance or not, and give also feedback to our team of anything you see that can be improved in this scenario. Regarding the feedback part, you have 3 important reports that help you understand how well you have treated your patient. Okay, so the first one is the timeline, where it details every action that you have done. You can review after the simulation with your team or with your classroom, everything that you've done, if you missed anything, or was this critical to do in the very beginning? Should we thought of any other approach? And then you can also go ahead and try the case one more time and see how the patient reacts to another treatment approach that you choose. So the system automatically has a calculation for the global score and it scores your performance in these 3 categories. So first one is the physical examination, then you have the diagnostic activity, then you have the treatment part. In the physical exam, we can also see in more detail the ABCD options, and you can see what have you missed, what have you done correctly, what you could have done as a second priority, or what you did incorrectly in terms of the critical actions that are supposed to do in a case like this. And the same for the diagnostic activity. So if you see which dialogues you have missed, you should have asked to the patient, and also for the tests. So they consider that a chest X-ray was not considered a priority for this patient, and the other options as well. You also have the knowledge section that gives you the list of clinical competencies that you've been applying while treating your patients. So it's also available for the teachers in our learning management system. So you can see which clinical competencies your students are working on. And it also helps you to choose the best cases that you want to do in a specific week or in a specific classroom that you're leading. And finally, you have the take-home messages. So it wraps up all the important actions that you should have done with a little bit more information for each of them. We also have the scientific references that are behind each case. So all of our cases are expert reviewed and built with a large network of medical experts and nursing that we work across the world. And of course, they all follow the well-established guidelines and references. As you can see here, these are the ones specific for this case that if you be interested, you can search a little bit more about them. If you are a professor, you can also add your own learning resources. So imagine if your students, after doing this case, you want to share a specific document, or you want them to see a specific video or any sort of document, you can add it here, and then the students will receive it in their hands. So I don't know if you have any specific questions that you would like to ask now. If you'd be interested in having a specific trial of Body Interact, it's also available. I can also share with you. Let me just open a minute. So we have a COVID-19 course that we have for free. So everyone who wants to practice with this course, it is possible. So it has built with contributions from an international network of medical doctors that we work with. And it covers 6 virtual patients that help you to recognize, stabilize, diagnose, and treat patients infected with COVID-19. So it has been used by hundreds of thousands of users so far for 1 year, and it's a very interesting course. And most recently, we have the COVID-19 vaccination course that we have developed with the Portuguese Red Cross, and it also approved by the International Red Cross, that covers 4 cases regarding the preparation of the COVID vaccines and the recognition of the different types, and also possible complications that may arise, and can be prepared to act to stabilize and diagnose these patients. So this is available at our store. So just type in store.bodyinteract.com and it is available for every user. Even if you're a student or an educator, you can access them here. So, Constance, are you in the nursing aid program? Do you have, for example, any specific questions that you'd like to see, or anyone else would like to know a little bit more about the programs that we have? So I can tell you that right now, we have a subscription model for the schools. So if your school subscribes to the program, you have unlimited access for 1,000 users. So you can have all your students and professors in there. The professors always have access to all the cases, and it's instructor-led sessions with students. So you decide whenever and which cases you want to decide for your students to do. So Constance, you're curious about the scenarios related to nursing aid in general. I can show you our list of clinical scenarios that we have for nursing. Give me just 1 minute.
For nursing, we have several areas: cardiology, wound care, so fundamentals of nursing, so different scenarios with different levels too. So basic, intermediate, and advanced level.
So I'm sharing here our content package for the nursing. So Anna, maybe you can explain a little bit more than me what it covers in general.
Yes, nursing emergencies. So about many problems with in the emergency room. So we can find the maternity and women's health nursing. So the pregnancy woman and the problems appears in the pregnancy woman, how to assess, how to treat. So in the basic and intermediate cases. Next, respiratory care, it's a content package regarding the respiratory problems and issues. About the position of the patient, the administered oxygen, so different and several pathologies. Medical surgical nursing, it's a content package, a basic content package, and we have a medical surgical nursing too. Is a more advanced content package, the next one. Yes, this is more advanced than the medical surgical nursing one. Fundamentals of nursing, it's a basic content package too, for a different for several areas regarding trauma, regarding high blood pressure. So it's to develop the communication to the patient. So it's a good content package. And next one we have a wound care. So you can see the wound. You can see you can assess the wound. You can treat the wound with disinfection, with cleaning. So it's a wound care regarding the care of the wound. So regarding cardiovascular care, this content package has several areas. So heart failure, atrial flutter, so myocardial infection. So it's several areas of cardiology, and it has basic and intermediate cases too. This specific content package has cases regarding electrophysiology. So when you can see the relator of the ECG and the report with ECG and the treatment for this pathology. So we have several cases, nursing cases.
Thank you very much, Anna.
Welcome.
So you're also allowed to have both in-person or online classes. I don't know if you have resumed or not your in-person classes, but it's a software that during the COVID, we have passed all of our current clients and new ones to an online and remote approach, which is also possible and interesting to do. So let me know if you have any specific questions that you'd like to have. If you would like to try Bot Interact for yourself, or if you'd like to choose specific scenarios, you can also go to our trial page here. So you just need to type trial.botinteract.com. You put in your details. You say, for example, I want cases for nursing, and then we can create you a specific account and have a little more conversation with you. Currently, we are doing a very exciting competition at HOSA with 61 teams. I don't know if your students from your chapters are participating or not. But this day and yesterday was the preliminary round. Now we're going to have 15 teams advancing to the final, and it will be a live session in Friday. So it's going to be very interesting. And the top 10 winning teams are having a 1 month free license for their school to use Bot Interact. So I don't know if your students are participating or not, but we think it's very interesting, and we are glad to see them in the final. So I'm going to leave my contact in the chat in case you want to start a specific conversation, if you want to see specific information that can help your curriculums and your nursing program. So it's raquel@botinteract.com. Bot Interact has also been used through several grants and funding opportunities. So if your school also have Bot Interact can stand as an educational tool for that. We have been used in a lot of opportunities like that, just for you to know that it's possible as well.
So we have a clinical, medical clinical cases, nursing clinical cases, high school clinical cases, and EMES clinical cases. So there are several areas to cover.
So if anyone doesn't have any more questions, maybe we can summarize everything that we do. Appreciate your presence here. Very pleasure to be with you. Hope you have understand a little bit more about Bot Interact, and hope to be in contact with you in the future. Thank you and enjoy the conference.
Thank you, everyone.
Have a great day too.